Assalamualaikum to all. Our lecture topic for today is recognizing red flag symptoms and signs in primary care. The lecture outline will cover the following: introduction, the diagnostic model, what is a red flag symptom or sign, why is recognizing them important, group discussion followed by summary. Primary care medicine is a specialty which sees a wide variety of symptoms coming from all specialties. Furthermore, symptoms that you see can be typical or the atypical presentations of illnesses. Thus, although the clinic is busy, you have to have a fail-safe system of assessing patients. More importantly, red flags of diseases need to be identified. Failure to do this will cause legal implications to doctors. Based on MOTA, the diagnostic model for a presenting problem needs to follow the following principles. First, what is the probability diagnosis? Secondly, what are the red flags not to be missed? Thirdly, what are the pitfalls? Fourthly, what the masquerades of the symptoms? And finally, is this patient trying to tell me something else? The prompt mnemonics during your consultation is advised to be used in order not to miss these principles. What are red flags? These are signs and symptoms that point towards sinister pathologies. You need to know these red flag symptoms and signs because they need to be addressed urgently. Missing red flags can be fatal or cause serious comorbidities. Recognizing red flag symptoms and signs change patient management. Either they need to be admitted to hospital or can they be discharged? The importance of recognizing red flags can be seen from this newspaper article on the 10 red flags of cancer. These are the red flag symptoms and signs of a few common conditions: back pain, cough and sore throat, chest pain, red eye, mood change, vomiting and diarrhea, skin mole, and abdominal pain or dyspepsia. This graph shows the overall top 10 reasons for patient encounter in the primary care setting of Malaysia. For back pain, this case scenario can be used to illustrate an example. A 65-year-old gentleman, retired, presented to clinic with 6 weeks history of low back pain. He also noted unintentional weight loss of 5 kilograms over the past 2 months with reduced appetite. He had previous history of colon cancer, which was treated 5 years ago. Think of few conditions that can present like this. This scenario is for cough. A 29-year-old factory worker came to clinic with 2 months history of cough and night sweats. He also noted that he gets easily tired and his clothes felt loose compared to previous. He is an active smoker, smoking 1 pack a day. On examination, he appears cachectic. Temperature was 37.4. Auscultation of the chest was clear with equal air entry. What are 2 conditions that can present like this? Here is a case illustrating sore throat. A 6-year-old girl presented to clinic with 3 days history of sore throat and fever. She is tolerating orally, but appetite was poor. Further history revealed that she did not complete her vaccinations as her parents were against it. On examination, temperature was 38.2. Inspection of the throat is shown in the picture below. Please give a diagnosis. Here is a case for chest pain. A 65-year-old gentleman, pensioner, presented to clinic with sudden onset severe midline chest pain, radiating to the abdomen and back. It is associated with breathlessness and palpitation. On examination, there was unequal radial and femoral pulses. What is the condition that presents like this? Here, for red eye, a 52-year-old lady presented with painful red left eye for one day. She also noted presence of halos around her house lights. She has underlying type 2 diabetes and hypertension. On examination, her left cornea appears hazy with fixed semi-dilated pupil. This case illustrates mood symptoms. A 26-year-old gentleman was brought into clinic by his family members concerned of his change in behavior. He recently was fired from his job as a dispatch officer, which was his fifth job attempt. The family members noted him to show rapid mood swings and unable to sleep during the night. They also heard him talking to himself in his room. What is this presentation? Here is a case scenario for vomiting and diarrhea. A 19-year-old gentleman presented to clinic with 3 days history of fever, with diarrhea and vomiting. He also complained of myalgia and tiredness. On examination, patient appears lethargic and dry. Temperature was 36.8, capillary refill 3 seconds, blood pressure 100/90, and heart rate was 120. What can present like this? Give 3 differential diagnoses. This slide gives 2 case scenarios for abdominal pain. The first one, a 21-year-old single lady presented to clinic with 2 days history of lower abdominal pain. There was no fever, diarrhea or vomiting. Last menstrual period was 6 weeks ago. On examination, BP 100/80, heart rate 108, temperature 37.2, and there was guarding and rebound tenderness on palpation of the abdomen. What is this lady presenting with? A second case, a 55-year-old lady presented with epigastric discomfort for the past 1 month, which worsened after taking food. She also noted early satiety and weight loss of 2 kilograms over the past 1 month. There was no black stool and no change in bowel habit. What is this lady presenting with? You are advised to hold a discussion session with your lecturer to obtain the answers for the above case scenarios. Thus, in conclusion, it is important to have a clear diagnostic strategy when assessing patients. It is very important to assess red flag signs and symptoms in every patient encounter. It is even more important not to miss life-threatening condition, even if it is rare, during each patient encounter in primary care. With that, I thank you.